Breast cancer is now the most commonly diagnosed cancer in the world, according to researchers. According to the International Agency for Research on Cancer, breast cancer was diagnosed 2.3 million cases last year. That surpasses lung cancer for the first time. Our Leah Blackburn is in our newsroom. Leah, what is the takeaway from these numbers?
Well, statistics also show that breast cancer makes up 11.7% of new cancer cases in both men and women. While experts are encouraged by strides in early screenings and detection, they say the first step, though, is truly understanding your risk. We spoke with Dr. Megan Beer, a breast surgery fellow at Indiana University IU Health. She says risks include a series of factors we can change, like watching our alcohol intake or more physical activity. And then there are some we can't change, like our age or family history. Beer says it's important, though, that people understand there's more to it than just family ties.
A lot of patients falsely assume that because they don't have a family history of breast cancer, that they're not at any increased risk, when in all actuality, about only 15% or so of breast cancers are actually associated with a family history.
Now, because of early screenings and detections, Beer says they aren't seeing a lot of patients with breast cancer symptoms. However, some signs to watch out for include lumps or swelling in the breast or underarms, skin irritation, or even pain in the breast or nipple area. And starting at 40 years old or 30 if you're high risk, the American Cancer Society recommends women consider yearly mammograms. Beer says men are often diagnosed later, though, due to not being screened with mammograms. But the prognosis in both men and women is still the same. In the newsroom, Leah Blackburn, Fox 59 News.